Now I'm here with Dr. Xiaoying Wang. She is a professor of radiology at Peking University, and she just delivered the Mansfield lecture. Now tell us a little bit about what your lecture was about.
Yeah, my lecture is about MR imaging in personalized medicine. So during this new technical advancement of gene sequencing and new target drugs, we have new perspective of our medicine. The patients are being divided into many subgroups for target treatment that will make their treatment more precision and more good prognosis. So during this whole process, MRI can give the information of the diagnosis, of the guiding the treatment, and follow the treatment to evaluate it. So with this new definition of personalized medicine, we can give more precise information about the patient.
Really cater to each individual person's needs, right?
Yeah.
How has personalized MR evolved? What are some of the changes that you've seen and the challenges going forward?
Yeah, so during this MR evolution, we have to make the MRI imaging give more information. Means we should use more biomarkers to quantify quantitatively and qualitatively to evaluate the patient. We should know the perfusion, blood perfusion. We should know the structure of the tumors, and before and after the treatment, we should compare the treatment effect quantitatively. So that is not so difficult from our previous practice, but right now we need more and more these types of information.
Yeah, the more information, the better to empower our members here. How do you see MR becoming more personalized? Do you think that more technology needs to be developed in order to get to that level?
Yeah. Because right now we have many softwares and hardwares, but now we have new clinical requirements. So we have to modify our software and hardware to bridge the gap of our new requirements and our previous standard service of MRI.
And how challenging is it to incorporate these new technologies into health systems?
Yeah.
Is it difficult to try to incorporate? What's the time that takes?
Yeah, there's some opportunities and challenges. So I think the most challenge is our society, our MR expertise should know that we are moved into a new personalized medicine or precision medicine, and then we should change our ideas. What type of information should be given to the clinical doctors, and then we should change our technical devices. So this is maybe a step by step, but from the idea, from the brain is the most important thing to change.
Well, a lot of the talk here at the conference has been MR value, right? And the challenge of the cutting of costs in healthcare. How important is personalization in this type of climate? Is it a challenge to get it, pushed forward amid other priorities at the moment? Yeah,
I think the value is the most important, not of MR. All imaging modalities should value themselves. I think the most important may be the appropriateness. When should we use MRI? And then the second, how should we use it? We have to standardize to give the consistent information to the clinicians. And then we should use the new techniques, new ideas to change our clinical practice in radiology.
Yeah, how will the MR industry change if it's used more often, the personalization of this all?
I think the change is going on. Each time we have
it's already happening.
Yeah. So each time we're talking about new genes, new drugs, so we're talking about what is the new criteria of MR imaging. What is the new techniques, new sequences should be scanned for this type of appropriateness, for this type of indications. So we are going on. We are
being a real pioneer in this field. Yeah. Thank you so much for being with us, Xiaoying. Enjoy the rest of the conference.
Thank you so much.